Well, welcome to our webinar. We're so excited to have those of you who are in attendance. I am Dr. Leah Jeanette, and I just want to say welcome. We'll go ahead and get started. So a quick agenda for us. We're going to talk a little bit about Case Western Reserve University School of Medicine. We'll jump into talking about the Medicine Society and Culture concentration, and talk about the program overview for the Masters in Bioethics and Medical Humanities. We'll talk about student assistantships and financial aid. We'll talk about the application process and the deadlines. We'll talk a little bit about Cleveland, Ohio, and where we're located, and then we'll go into a little bit of Q&A. If you have a question as we are going through, please feel free to use the Q&A feature here on Zoom. You can go ahead and type your question in and hit send. We may answer it as we go through, or we may save it towards the end. So we do both as we go. So feel free to submit as we go along. Next, I will introduce our the rest of the group here. So we have Dr. Eileen Anderson-Fye. She is the Director of Education, and she's an Associate Professor in the Department of Bioethics. She's also the Director of the Medicine Society and Culture concentration. And I will, once I turn it over to her, I will have her introduce herself more and tell you a little bit more about herself and her background and her work. You can see myself in the middle. I am Dr. Leah Jeanette. I'm the Assistant Director of Education and a Senior Research Associate in the Department of Bioethics. I wear a couple of different hats in our Department of Bioethics. I also do clinical ethics consultation at university hospitals, which is one of our teaching hospitals here in Cleveland. I work with incoming students. I teach in our department. I do a little bit of work in kind of the research space in terms of just, interested projects and that kind of stuff. And then lastly, we have on our screen here is Sam Hamilton. She's the Assistant Director of Enrollment Management for the School of Medicine. Sam, I'll have you introduce yourself.
Hello, everyone. My name's Sam. I work over in the enrollment management office, as Dr. Jeanette had mentioned. Today, I'm more of the behind-the-scenes kind of person, making sure that all the tech works correctly, but I'm usually the one that helps to make sure everything runs with the enrollment initiatives and those kinds of fun things. But I'm excited to learn more from Dr. Anderson-Fye about the Medicine Society and culture concentration.
All right, so Dr. Anderson-Fye, I'm going to turn it over to you. I'll let you introduce yourself, and then you can kind of launch us into the webinar.
Thank you so much. It is a pleasure to be here. Always an honor to be with Dr. Jeanette and Sam Hamilton. And with those of you who have joined us today, both synchronously and those of you who may listen asynchronously. So thank you for being here. As Dr. Jeanette said, I am the Director of Education in the Department of Bioethics at Case Western Reserve University School of Medicine. And I run our programs in Bioethics and Medical Humanities. Those are our degree granting programs. We have subspecialties in those that are relevant to medicine, society, and culture in medicine and health and the arts, and in social medicine. So we'll talk about all of that a little bit later. I myself am a Cleveland native, delighted to be back here. I ended up leaving Cleveland. I actually had the privilege of being the first one in my family to go off to college. And the hard thing about that is no one knows what advice to give you. But the great thing about that is you can kind of study whatever you want and without getting reprimanded that I should be doing, something very pigeonholed. And I think that is why I'm really drawn to these interdisciplinary ways of investigating these important questions of health and illness and disease and suffering and wellness and human development, these ethical questions that we face throughout our life cycle, the beginning of life, the end of life, and a whole variety of ways to look at the ethical, social, cultural, political, economic components related to health and healthcare delivery, and the experience of disease and illness and healing. So I did leave Cleveland. I did an undergraduate degree at Brown University, and I did my master's and doctorate at Harvard University, where I had an incredible opportunity to spend time in human development and psychology, anthropology, and also social medicine in the School of Medicine, where I was also introduced to ethics. So that, and I did a postdoc at UCLA in developmental neuroscience to get some more of the biological and neurobiological components of all of these questions that we're interested in. But one of the things that is so fabulous, we'll talk about our department in a minute. So let's go ahead and advance the slide. So I'm going to talk about kind of nesting dolls, right? Like the university is a phenomenally dynamic, wonderful place to be. And in this space, that is one of the reasons why I am back here at Case Western Reserve University. When we're talking about bioethics, medical humanities, social medicine, there are few places better to be than Cleveland, Ohio, because of the powerhouse strength of the university and the School of Medicine, our collaborations across the university, but also in the region with major hospital systems we'll show you, our museums, our orchestra, etc. It's really astonishing. So it's not a huge surprise to me that in a state with some really excellent medical schools, many of whom we collaborate with. We are #1 in Ohio for research and education, and in medical research, we were recently ranked #25 in the nation, although that is climbing right now. And from an educational standpoint in the School of Medicine, in terms of value added, we are actually easily top 10. So we'll advance the slide, but the School of Medicine is just a booming, dynamic environment that, again, our Department of Bioethics has collaborations with all of the hospitals in the area. Our students do 80 hours of clinical rotations in a public and a private hospital, which we'll talk about in a bit. But it's a dynamic environment for multi-level, I would say, exposure, experience, analysis of health and healing and healthcare, etc. So our MA degree is a very intensive 1-year degree that can be done in 9 months. Some students will choose to bring it to 12 months, but it is, the majority of our students will complete the degree in 9 months. And there are various concentrations within that very broad spectrum of bioethics and medical humanities. So I'm going to begin, since we're focusing on one of our dynamic concentrations, which typically about half of our students every year do the Medicine, Society, and Culture concentration, which is a deep dive into the medical humanities and social medicine aspects of what we do. So why does that matter? Right? Like, why do humanities, social sciences, arts matter? Let's start with thinking about kind of a large structural perspective. If we are thinking about our biggest killers, let's say like the largest killer of children in the world it is not a rare disorder. We're talking about things like diarrhea, dehydration, right? Those are problems that we know how to fix medically. They are not expensive to fix medically. In the wealthier countries in the world, even though there is always internal discrepancy, very few children were worried about them dying of dehydration or diarrhea. However, if we look globally, this is still our number one threat, right? So the reasons for that are not biotech. They're not, like oral rehydration therapy is very straightforward. It's simplistic. It is inexpensive. It's not that hard to get your hands on. So why is this still such a problem? It's because of political, economic differences and social differences. It's structural inequality, where some parts of the world have many more resources than others, and the resource scarce parts of the world, we are still dealing with threats across all stages of the lifespan that have been, largely that we can cure in wealthier parts of the world. So we can take like the number one infectious killer of adults pre-COVID anyhow, tuberculosis, right? That is something that in wealthier countries and in wealthier areas of the kind of global north, people are not particularly, there are some exceptions to this, but people don't walk around worried about dying from TB. It's something we've got some really good antibiotic treatment to, et cetera, but it is still a huge threat, problem, everyday burden, an everyday threat in the majority of the world, right? And even within a place like the United States, it is a threat in some pockets of resource scarce areas. So those are like social medicine problems in a way. We can talk about behavioral health also. But when we're looking at kind of questions of social justice, questions of inequality, questions of flow of resources, why aren't mosquito nets getting to the people who need them to protect them from malaria? Those kinds of questions are embedded in social medicine, and they help set these large-scale patterns for health and disease, longevity, and death and dying around the world. Medical humanities come into play in a lot of ways as well. So a couple of examples. One is learning from history. And I think in the face of the COVID-19 pandemic, we learned and we looked to history, right? We looked to the influence to, prior pandemics, like 1918, and even beforehand, where we were reading, public notices about mask wearing and how controversial it was over 100 years ago. And here we were dealing with it again, right? And so thinking about humanistic study could include things like learning from history. We certainly do that a lot in bioethics. We look throughout history at some of our horrible, egregious ethical violations, something like Tuskegee, the syphilis study that was a horrific infringement on people's rights and lives and health, and really in some ways set the stage for American bioethics to step up. We can look at resource allocation. We've drawn on historical examples, even thinking about, early vaccine distribution, et cetera. So looking at historical perspectives are important. Thinking about the ways literature can engage people's imaginations and understandings of an illness and communicate illness experience, maybe to a family member, maybe to a caregiver, maybe to help someone process their own narrative. We've got a whole class that we offer on narrative methods and thinking about narrative ethics as well. right? So these can also kind of help the process of healing for many people involved in a particular case. It may be the patient themselves, it may be their caregivers, it may be their family and close others who can learn from methods, techniques, from disciplines such as English or literature. So we could go on and on. We do some wonderful training in the arts with thinking about how learning some of the techniques of art and art history and how to really see a painting, how to really look at a painting, that experience in a museum. We have empirical evidence over and over again from multiple institutions now across a couple of decades, that kind of art and art history training makes for better clinicians. It makes for clinicians who can look at a patient, who can look at evidence of a condition and actually make a more accurate diagnosis, make a better diagnosis. And that's a whole fascinating area in the arts. So those are just some simple examples across the kind of level of social sciences, across humanities, across arts, where regardless of if you are going on to be a clinician, maybe you want to be a doctor, be a nurse, be a PA, be some other kind of clinical care provider, a psychologist. We have students who go on to all different areas of these practices. Having this kind of medical humanities, social medicine, arts and medicine type of training generally make for better clinicians. And the evidence down the road, when someone's had this training and then they've been practicing for 10 or 20 or 30 years, we get two kinds of evidence. We get one, there is a good amount of evidence that there's efficacy, that people are better clinicians than folks who haven't gotten this kind of training. Of course, it's not every provider, but there's some pretty convincing data that this type of training that we do in medicine, society, and culture, which is really based on empirical evidence, produces better clinicians with better outcomes. And it also kind of helps the soul of the caregiver, which often gets put in the bin of professionalism, that people who have this kind of attunement to seeing their own practice, to seeing their patients, to seeing the care team and the institutions they're working in and the localities in which they're working in, have less burnout and feel more fulfilled by the later on in their careers. For our students who are not going on to be clinicians, but maybe they're going on to a PhD, or they're going on to a research career, or they're going on to a nonprofit, this type of training tends to result in, first of all, it's remarkable kind of clinical hands-on experience for anyone interested in going on to something like a PhD or a research career. But it also creates a multimodal, multi-level analytic ability that we hear about from our alumni now, 25 years worth, and we see reflected in the outcome literature, et cetera. So that's a lot of answer to why in the world do these areas matter. They matter so much. And maybe, never before in my professional career, before this pandemic, where we are so aware of how all of the non-biological aspects of health and disease and healing and suffering, how much all those other levels mattered to outcomes cross-culturally and intraculturally. All right, let's move on. But, if you have other questions about that, I'm always happy to talk about them, answer to the best of my ability, or refer you to someone who knows better. So why should people study bioethics and medical humanities? You know, the healthcare industry touches us all, right? If we ourselves haven't had to have that many touches with us, with it, certainly those around us, in our families, in our social worlds, and, you know, really all around us every day as we're still dealing with questions of pandemic, really, that we have constant advancements in biomedical science and technology. Literally right before I came on this webinar, I was doing a class for our translational fellows at Case Western Reserve University. So these are PhD, MD, and PhD, you know, MD, PhD inventors who are innovating in healthcare and trying to build translational companies that you know, make a difference in the world and are providing brand new cutting edge therapeutics or you know, technologies. And the ethical concerns laden, for example, with what we can do now with medical devices and AI, there are ethical questions about that, you know, we couldn't even have imagined 10 years ago, right? So there are constant advancements in our science and technology, and also in our healthcare delivery, right? We're at a time where, for many standard procedures, a robot can do a better job than a human in a particular procedure. But it's the humans who have to answer these other types of questions, not can we intervene, should we intervene, right? The ethical question there. And as I was alluding to, you know, with kind of the social medicine questions, how should we intervene to get some kind of just and fair delivery of even basic primary health? What kinds of values should inform policy and practice, right? So different levels, practice, let's say at a clinical level, policy at a more global level. What about research? You know, how do we ensure justice and respect for people who are involved in research and clinical practice? How do we know that we are consenting someone in an appropriate way? How do we know that we're recruiting in an appropriate way? How do we know that we're executing research in a way that is fair and respectful and not doing harm, for example? So these are, you know, some of the questions that we engage throughout the year in this program.
You know, Dr. Anderson-Fye, I just wanted to add, the talk you just gave earlier sounds really interesting. Something you said actually made me think, you know, one of the other questions we can even add to this is, even one of the further questions you can even ask about AI is, who's doing the programming of these technologies? I recently read an article that was talking about the AI technology that they're incorporating into the justice system. So they're trying to automate the legal system with sentencing to try to eliminate racism, and trying to see if they can do that. What they're finding, though, is that those who are programming may already have racist and unconscious bias behind it.
Absolutely. And Dr. Jeanette, a colleague of mine at Harvard actually studies the bias, the racial bias that goes into the coding itself, that is embedded into code, right? Okay, so I don't code, so I don't, you know, I can't understand that.
As you were talking, I was like, even within these advancements of artificial technology, it's like the code itself could actually have unconscious bias by the programmers.
No,
right?
absolutely.
It's so challenging of like, ensuring justice at every level of what we're doing.
And having to ask these questions, you know, at I think your point is an excellent one, that they really are embedded at every level. and I could tell you about another collaboration I have with one of our biomedical engineers who is, runs the Human Fusions Institute, right, where we have, artificial technologies that people can use to move, but also that can be removed from the individual who is having the sensation of them. We can put an artificial limb across the country, and someone on the other side of the country can feel everything that limb is doing. That kind of technology, is a game changer. And thankfully, my wonderful colleague, Dustin Tyler, who is running that project, brought in ethics from the ground. So yeah, it's all the way down. Right. And it's all the way up too. It's at every policy level. We can talk about a healthcare system. The US tends to prioritize autonomy over our other important bioethical principles, right? Absolutely. And so we have a healthcare system that, does not provide everyone the same care. We can look at our northern neighbors, right, where justice is a larger value than autonomy. And even if you're high up in the government, you're going to wait in line for your particular surgery, which is why we have a lot of medical tourism and other, but these values that we study in depth over the course of this degree are embedded kind of all the way down and all the way up. And we could talk about epigenetics and how structural racism is, epigenetically apparent in the body, generations after. So after a traumatic event, such as slavery in the US or a genocide, et cetera. So I will stop there because I could give 100 examples, but, but it is all the way down and all the way up, no doubt. And we're learning a lot about that, which is exciting to be at the vanguard. This kind of area, bioethics and medical humanities, is one of those spaces where, regardless of what your level of interest is, and every year our student body is diverse. We have people who do bench science, we have people doing global health, and everything in between. And that is partially by design, so that people are talking to each other and you're learning from peers engaged in these questions as well, because those levels of analysis are not independent of one another for the most part. All right, so how is this kind of study good for your career path? As I think we've discussed all the way through, it is really an interprofessional science and study and art, and it is extremely multidisciplinary in both its origin and in its current practice, yet it is a unified field. It's this incredible balance. And so this area is really, even if you are going on into some very specialized area, getting the experience of talking to people from different disciplines with different areas of maybe technical and theoretical expertise, and different roles in the healthcare system is incredibly valuable and valued by people who are doing the assessments into a further graduate degree program or a professional pathway, or what have you. This is something that has become much more mainstream. We've got an amazing track record of launching students in their professional careers in all these different areas and more, right? So I want to talk, the other ones are pretty self-explanatory. I want to just mention that last one, discernment for the undecided, because of the way that this program is designed, which includes a heavy-duty foundations class that all of our students take. People are exposed to lots of areas of theoretical knowledge, empirical knowledge, and clinical practice. So a lot of our students who come in and say, I don't know if I want to be a clinician or a researcher. I don't know if I want to be a sociologist or an anthropologist. I don't know if I want to study pediatrics or geriatrics. This program really is excellent for helping people discern which pathway might be best for them. And I will say another amazing thing that I continue to watch with this program is now that we have 25 years of alum who are all over the country and all over the world, there is a really remarkable networking. People open their doors, alum open their doors to talk with our current students about what do you want to do? Where do you want to work? How can I help you? How can I help open a door for you? So that's another aspect of this program that is really, really special. It's almost like an extended, intellectual professional family in a way, but it's been really stunning to watch how alumni reach backwards and put out their hand to help current students into all sorts of different futures. And if you have a good idea of what you want to do and you want to ask, is this program a good match for me? That's what we're really looking for, is the capacity to do this very intensive high level work at an R1, top-notch medical school, but also for good fit, that you're going to get something out of it. And that, it's going to be a nourishing, stimulating environment for you so that you get what you need on your pathway. And we're pretty, if you have contacted the department or you speak with the department, we're pretty straightforward about, not sure this is the right one for you. Maybe here's another program to think about. Or, wow, this would help you in the following ways. And these are the resources we could offer you. So this is, our department so our program is one of the oldest in the country. We're going into our 26th year, but also the department is one of the oldest in the country. It began as a center, and we are celebrating this year our 20th anniversary. So it's a very, very special anniversary for us, and we're hoping we can have some live events in the fall, and certainly we'll be carrying that over into 2022 as well. Of course, we have to see how all of the pieces of, the dominoes from the pandemic are falling and changing, and, we're watching carefully in the School of Medicine and at the university. It is, as I mentioned, a one-year program, which, can mean one academic year of 9 months. It is 30 credit hours. You will have certain requirements in the program, such as a 6 credit per semester, so a total of 12 credit foundational course that takes you through the major perspectives on bioethics and medical humanities, and then kind of moves through the entire life cycle from conception through death and dying. And also goes into lots of contemporary topics, such as some of the things we were talking about before: R&D, stem cell research, regenerative medicine, global health, public health. We did an interdisciplinary class, not shockingly, on pandemics this year from all kinds of ethical, humanistic, and social science and arts perspectives. And so you will have this kind of foundational education. You will have clinical ethics rotations at one of our 4 major hospital systems. We have 2 private, 2 public that we partner with. Generally, students will spend 1 semester in a private hospital and 1 semester in a public hospital. Each hospital has its own culture, and that is something that we're reflecting on as well. Those are required 1.5 per semester. Every student will write a capstone paper, although occasionally we do have some other creative performance, or this year we had a podcast or some other things that can be part of that capstone. But typically that is a mentored research paper that you are working closely with a faculty advisor on, and you become an expert in a topic. So I actually have this year, 4 of the capstones that I was working with students on are in process of publication. That is not something required. That is not something most students will do, but that is something possible, as depending on your goals and what you need out of your own capstone. We offer, and we're very excited to be opening up again. We are, tentatively but cautiously, optimistically planning for winter short-term study abroad courses. We typically offer study abroad programs that count as electives. And we'll talk about those a little bit. Many of them are in other countries. So the one we're looking at in the winter is very medicine, society, and culture oriented. It is in Costa Rica, looking at kind of the Costa Rican healthcare system and comparative healthcare systems. We offer courses in Amsterdam and Paris. We've offered courses on things like water security in Brazil. I helped to develop and teach a course in Yellowstone National Park on environmental ethics and human health. We have one of those tailored in Northeast Ohio as well. So there's all kinds of really immersive and travel courses that count as electives in this program. There are, plenty of classroom courses offered also in our department and in other departments in the School of Medicine and other departments around the university. So you may have a real interest in medical history and want to take a course with the associate director of the Medicine, Society, and Culture program, who is a world-class medical historian based in the Department of History, who also works with us. There are courses, again, in all kinds of departments. We call Medicine, Society, and Culture for short, MSc. We offer, if you're doing that concentration, you would take an in-depth seminar on the foundations of medicine, society, and culture that is co-taught by myself. So a medical psychological anthropologist, a social scientist, and Dr. Jonathan Sadowski, the associate director, who is a medical historian, who also has interdisciplinary training that we can, talk about or answer questions about. And that's that core course there. So if you're doing a concentration, in addition to those required foundations classes, clinical rotations, and capstone, you would also take this intensive fall seminar. You would take another 1.5 credit seminar called the Medicine, Society, and Culture Seminar, which is in some ways an intellectual engagement credit. It is attending and reflecting upon different disciplines, different types of events around the university, maybe at a related conference, or now that we, many departments and institutions have created, Zoom opportunities. We'll have a limited number that can be done by Zoom, where you are really engaging with maybe museums, or we have on our campus one of the best museums of medical history in the country, in the world. So it could be something that they're hosting, or it could be something that is being hosted at a hospital. What we're looking for there is intellectual engagement across institutions and across disciplines. And so each kind of seminar log sheet, reflective sheet is going to look a little bit different. It's because, as you will see in terms of how you choose your electives, And as was, alluded to on the prior slide, we take personalization very seriously in this program. That's across the program. That is also within the concentration. If you have a ton of humanities courses in your undergraduate education, we might encourage you to reach out and take something that is more social science, and vice versa. We have students who come in every year with some kind of music or performance background, and we think carefully about how to engage them and continue that aspect of their education as well. So the clinical rotations, all students in any concentration or in the traditional program do clinical rotations in the fall. In the spring, if you are meeting the requirements to do a medicine, society, and culture concentration, some fraction of our students every spring will do another sort of practicum that is not one of those 4 major hospital systems. So in recent years, we've had students placed at the Department of Public Health. We have had students placed at our local free clinic. We have had students embedded in a relevant research project who are going on to something like a PhD, where their final project is going to be a paper that goes out for publication. It depends on what your professional goals are and where you are in your process of thinking them through or taking that next step. But it is, and if you were interested in some other, we've had international focused practica for MSc. It really depends on needle exchange programs, working with the homeless. It depends what your interest is. Those you would talk with your advisor, and you would get them approved with me as the director of the concentration and educational programs. And we are really looking for, is it a good fit, and does it meet the educational requirements? We also have a monthly reading group, which many students will contribute toward their medicine, society, and culture seminar credits. That may be a work in progress by one of our faculty members, or by one of our fellows, or by one of our students even we've had recently. Or we have various themes that we might explore through that monthly reading group. Sometimes we have lecturers who will kind of sit down with us around a table or around a Zoom, depending on what moment we are at, and really dive into a reading, a paper that they've written, a book chapter more in depth, to really explore it and allow people a much more conversational opportunity. So that's optional, recommended, kind of engaging group that brings in people from around the university and the hospitals, the museums and the arts centers, and the community at large. So this is just a visual of what the program looks like in the fall semester. You see that foundations of bioethics, your rotations, you would take the foundations of medicine, society, and culture if you were doing the concentration. Then you would have an elective of your choice that somehow is related to bioethics, medical humanities, social medicine. And trust me, we've had quite an array in that category. So you need those approved by your advisor and by the director of the concentration, who is me right now. And the seminar credit that I mentioned, which actually can be spread over 2 seminars or 2 semesters if you need. So in the spring, you're continuing on with your foundations and your clinical ethics, or your practicum. As I mentioned, you're doing your capstone, and you have a little more room for electives, which could include a travel course. They could include classroom courses. Occasionally, they will include 2 international or travel courses. Sometimes they're independent studies. If you have a real passion for something that is not being offered we can usually find a faculty member who is an expert in that area to work with you. It's a very collaborative department and program, so we've got a good track record with our colleagues all over the university and the region. So your clinical ethics rotations, as I mentioned, we've got our 2 private hospitals, the Cleveland Clinic and University Hospitals, and our 2 public hospitals, Metro Health and the VA. And Dr. Jeanette, since you are the director of the clinical ethics rotations, I'm going to ask you to describe them for us right now. Put you on the spot.
Absolutely, yeah. So as Dr. Anderson-Fye said, I am the course director for this course. So it is 80 hours in the fall, 80 hours in the spring. Some of our students who are around in the summer, especially our dual degree students, do take it in the summer. Students are able to spend time at the hospital, really getting a deep dive into the hospital culture, the hospital function. What is it like to be in that hospital system? So you're rotating with individuals, so social workers, chaplains, as you can see on the screen, genetic counselors, living donor advocates, pharmacists, music therapists, ombudsman is just a small sampling. The lists are ever growing and changing. You attend morning rounds in different ICUs, different floors at the hospitals. It could be going to committee meetings, whether it be the ethics committee, the IRB, research meetings, transplant meetings. It could be going to an emergency department with an attending for an 8-hour shift. 2 of the hospitals, Metro Health and University Hospitals, are level 1 trauma. And if you're shadowing an attending physician for an 8-hour shift in a level 1 trauma emergency room, you better be wearing good tennis shoes and be prepared to run for 8 hours, because you better believe it's busy. If you're, I know at Metro Health, we encourage our students to do a 11 p.m. to 7 a.m. Friday night shift. They are very busy. And so it's a way for students to really get an inside view of what a healthcare system looks like, and what the student's role is to extract the ethical issues, to look at clinical ethics and think about what are the ethics in what I'm seeing. And so that's the student's role. And then on a weekly basis, you meet with a preceptor. So a clinical ethicist or someone who sits on the ethics committee at the hospital system, and the other students who are also rotating at that same hospital, to talk about what you've experienced, the ethical issues you saw, or something that maybe you're not exactly sure what the ethical issue is, but what you can say is, I'm not sure. It made me uncomfortable. I'm perplexed. And it provides a safe space to talk about it. And so you get together weekly to talk through those things. You submit a weekly journal and a log. You identify 2 cases to write up and do an ethical analysis on. What's great is by the 2nd semester, you have experienced one hospital system. And so you're in the 2nd hospital system, as long as you're not doing that practicum experience, and then you get to compare systems, which is really interesting. And so if you're doing, when we're trying to assign you to one public, one private, you're also comparing different culture of systems. Systems do make their policies different for different reasons. There's history to it. There's, money differences. There's just different ways of doing it, different trainings, different, logics and those kind of things. So it's a really great experience. Honestly, it's one of the main reasons that students choose our program. There are I don't know of any program that does clinical ethics rotations quite like we do at the high level that we do them, with 80 hours over 80 hours per semester, and have the opportunity at 4 at these 4 major teaching institutions.
Thank you so much, Dr. Jeanette. It really is exceptional. And, you know, over time with all these alum, when we ask them, you know, what really stands out for you? This is, you know, this is really one of the aspects we hear about most frequently is these rotations were just pivotal in the rest of their career. You know, a travel course can be, a classroom course can be, but these, the ethical, the rotations and then the precepting are just so poignant because you never know. You know, for some students, you know, they may witness their first death or birth or, you know, all kinds of different experiences like you were saying. And it's, you know, some things are predictable. Like we've got a really good sense if you're in the emergency department, there's certain things you're going to see, but other times you just never know. And being able to be held in a community to make sense of it, to deal with it, to think about it carefully, to process it is something that really stays with our students for a lifetime, I believe, both as professionals and also as people.
And the other thing I would say is, as you're doing these rotations, the things you're learning in the foundations class are going to ring true in your clinical ethics rotations as well. And so you're going to be learning about, you know, the theories, the approaches, the hypothetical world in the classroom, and then you're going to see the application in your rotations, which is kind of an incredible thing to have the application in front of you. I'll turn it back over, Dr. Anderson-Fye, to you. You talked about capstone a little bit.
Thank you. Yeah, and I'm not going to say much more about it right now because I really want to, we've already had one excellent question. I want to give some time for questions, but I think I did mention that. And this just is another experience that students, you know, it can be a little daunting. This is something you do in your spring semester, but you're starting to think about it in your fall semester. So maybe you're coming in like, I'm passionate about neuroethics, and that's what I know I want to do for my capstone, you know, or, you know, I'm passionate about, you know, drug abuse, and this is something I want to delve into, whatever it is. Or it could be, I have absolutely no idea, and I want to sit back in foundations of MSc and be exposed to things I've never been exposed to before, and really notice what excites me. What do I want to go back to? What do I want more of? What do I want to read? What's spurring a passion in me? And so there's room in the fall semester, you know, however you come in, to kind of figure it out. And it is doable. We scaffold your, you know, the stages of the capstone production in the spring. So people, you know, are making progress throughout. And then actually, oh my gosh, yeah, it was just recently we had our capstone presentations, which is like a flash presentation, and every student did 2 slides on what they did for their capstone project. It was riveting. And like the diversity and the quality of what these capstones were amazing. And I think it was really cool to watch students also respond to and network with one another kind of going forward as they were graduating and becoming alum. And that was during a pandemic where we were doing all our learning over Zoom. So, you know, it's a really exciting process, and, you know, finding people to work with is an option as well as you go forward. We also have another concentration. It is possible to do both. We've structured the courses that way. That is the research ethics concentration. It is analogous. Your extra requirements would be that kind of core course on research ethics and regulation in the fall, a 1.5 credit, and then a 5 credits research ethics journal club, where students are pulling contemporary topics to discuss in this research ethics journal club, which even if you're not a concentrator, you can do that for 1.5 elective credits, which a number of students who were MSc this past year chose to do and loved it. There are also different kinds of electives related to research ethics. And in this concentration, you are required in the spring to do a practicum in research ethics, where you might be embedded at the university IRB, institutional review board, or a hospital IRB, or something similar, where you are really have your hands in working on research ethics, typically regulation, but there's some other iterations. So that is another concentration that you could do alongside or independent from medicine, society, and culture. And we've got dedicated webinars on that if you are interested. This is another recap of our study abroad. These short-term courses that tend to be 1 to 2 weeks. Occasionally there'll be one that's 3 weeks in Costa Rica, Grenada, Netherlands, Paris, US national parks. And those are, they are, as I mentioned, held during winter break, spring break, or we've got a May term where students can really enjoy doing a course after their regular coursework is over. And that tends to be where a 2 or 3 week course comes into play. Again, as I mentioned, topics might be comparative healthcare systems. They might be like in the Netherlands, we're looking at kind of very different public health practices and how they play out there with respect to, drugs and other issues. We've got a comparative one in the Netherlands on women's health. So these, if you're interested in these kind of courses, we can tell you what is likely to be offered in the coming year, which again includes Costa Rica, and we're in the process of planning what might be offered in May as we're getting guidance from the university about appropriate and allowable travel. We do offer a number of dual degrees that you can see there bullet pointed. You do need to apply and gain acceptance to each program independently. But the cool thing about these is they generally cost a little bit less than 2 standalone degrees. And some of your credits will overlap, kind of double count. So students can generally finish them a little bit more quickly. So we do every year, we've got students who are doing a dual MD or a JD, other types of masters that are really synergistic with our masters, or something like a PhD in genetics. And we also have there the Masters of Genetic Counseling. And if you're interested in one of these, we can definitely help talk you through it for your kind of individual situation. But it's an amazing opportunity, and our dual degree students are definitely part of the community, like our intensive 1-year students as well. Financial aid, it's actually kind of unusual for a master's program to offer student assistantships, which we do. We offer students kind of, opportunities to be a research assistant or assist in teaching an undergraduate class, or different kind of program or administrative opportunities. And these are competitive. Our priority deadline for the coming year has been passed, but if this is something you're very interested in, we will look and see if there are any opportunities available. This past year, some of our students who didn't get assistantships or didn't need them in terms of tuition compensation also volunteered on projects and became co-authors or got some piece of really valuable experience that they needed for their next step. But the assistantships are a really cool opportunity. And I put in the chat already, or Q&A, in response to another question, which was excellent, which I'll mention at the end. And we will share with you our departmental email, which is what you should email if you have a question about this. We also offer all of the standard financial aid, have a very excellent financial aid office that you can work with. And we have a number of students who will take on work study positions. And this program is really designed to be able to be flexible. Some of our students even come in with full-time or near full-time positions. That's a lot. It's very demanding, but it is doable, and we can help talk about those options as well if you need it. So Graduate Studies provides our tuition information, and we can help connect you with these various offices and contacts if you need. So Dr. Jeanette, why don't you quickly run through the application process?
Absolutely. So required materials for a completed application package includes transcripts from all undergrad and grad programs. Unofficial transcripts are fine for the review process. We ask for a statement of purpose. This is 1 to 2 pages, double spaced is fine. What we're looking for in your statement of purpose is for you to write about your interest in bioethics and medical humanities and how this program fits into your career path. Next is your CV resume, and then 2 letters of recommendation, including one from a faculty or a previous instructor that you've had. Once we have your completed application, it's reviewed by a member of our admissions committee, and then you are interviewed by someone on our admissions committee via telephone or Zoom. A completed application can get processed very quickly, 1 to 2 weeks. Given that we are approaching our final deadline, which I'm going to move us to our next slide. We are still taking applications for this cycle. Our final deadline for you to hit submit on the application is August 1st. As long as you type in the name of your application, or as long as you type in the name of your recommenders and their email addresses, you can hit submit on your application. We are moving very quickly on reviewing applications. So when I say 1 to 2 weeks, provided that we have the completed application, I mean 1 to 2 weeks to get you an answer. It's closer to the 1 than the 2, but we say 1 to 2 just because people are in and out of the office. Metaphorically, of course, we're all still working from home. Orientation and classes begin at the end of August, so we are approaching the beginning of fall semester. I will say these deadlines that you see up here are going to be the deadlines for the next cycle. So if you're thinking about applying for the next cycle of applications, December 1st, 2021, March 1st, 2022 for IGS students, May 15th, 2022, and so on. So keep that in mind.
And there is time, if you're still thinking about this year, we are still getting applications in, and we're happy to talk with you if you are wondering if you should put an application in, or you are welcome to submit, and there is still time to process and be here in person for orientation, which we're very excited about. All plans for the fall are in person.
Yeah, absolutely. I'm continuing to meet with students, jumping on Zoom, doing phone calls. So we are happy to, have you put in an application for this fall. Really quick, some highlights of Cleveland, and we'll get to Q&A because I know we're over time.
Yeah, we are, I really want to be aware of that. So
here's how you
Cleveland rocks, and there's so much to do, and it's very accessible. We also have some excellent information on housing. People are surprised how much there is to do in Cleveland, whether your thing is music or art or green space or water or sports or theater or whatever. So we're happy, to connect you with alum. some folks are coming here from Cleveland. Most people are moving here from somewhere else. We've had years pre-pandemic where we've had students from 23 different countries. People are usually very, very pleasantly surprised about Cleveland. So thanks for moving us to Q&A. If you want to stick a question in the Q&A now, that is fabulous. You can also email us at bioethics@case.edu or give us a call. But the question about, is there a listing or resource where we might be able to view the possible courses and electives available to an MSc student? It's a great question. You can email bioethics@case.edu to get a list of our courses for the fall. However, we also approve courses on a one-off basis. So if you have an interest you don't see reflected there, those are the courses that the majority of our students will take. But every year, students will carve their own pathway, work with their advisor, work with the educational team to, look for courses in other areas. So we've got such a good read on what's going on at the university. We'd be able to help direct you or connect you or tell you, you know what? No, we don't really offer that here, but here's an expert on it at, a nearby hospital, and we can do an independent study, something like that. But we can send you the courses that most of our students are taking, and certainly talk you through other courses that might be right for you or answer any questions that you have. I don't see any other questions. So for the sake of time, I'm going to suggest that we go ahead and close. But please do feel free to reach out to us and ask us any questions you have about medicine, society, and culture, medical humanities and social medicine, the MA in bioethics and medical humanities, or the program itself, the university, the region, anything else that you're thinking about, you're wondering about, you're thinking about fit or opportunity. We would be happy to either answer your question or get you to the person who can. Thank you so much, Dr. Jeanette and Sam Hamilton, for hosting our webinar today. And thank you to those of you who came and who participated, and those of you who hung out for the whole thing, and those of you who had to leave or, watch it at another time.
Yes, thank you so much to everybody. And we hope that we were able to answer some of your questions. And like Dr. Anderson-Fye said, we are available to answer any questions you have. So we hope you have a great rest of your day, and we hope you consider applying to our program. Thank you so much.
Thank you.